Hey guys, today we are going to talk about anti-anginal drugs. So there are a few drugs we're going to discuss about it first nitrate, beta blockers, and calcium channel blockers. There's a simple physiology we gonna understand. There's the mechanism of smooth and cardiac muscle contraction. There's a simple way I can understand you here. There's a calcium channel, and there is a serpentine receptor over here. So let's see how it's gonna work. The calcium gonna go inside, the clemidulin gonna attach to the calcium and gonna make calcium clemidulin complex, and it's gonna further divide into MLCK. MLC gonna go to the further phosphorylation effect on the actin, and then muscle is gonna be contract. It's a simple mechanism you have to understand if you want to understand the drug where it's gonna affect on it. The serpentine receptor is like a snake-like receptor, and you can see over here. Epinephrine is gonna stimulate this receptor, and you can see here GS is gonna activate adenylyl cyclase. And what that adenylyl cyclase is gonna do, ATP convert to CMP, and CMP is gonna activate again MLC, and this MLC is gonna go there and gonna do muscle contraction. Then there's a lot of muscle contraction. What we're gonna do, muscle relaxation by the dephosphorylation of MLC, myosin light chain kinase. It's a simple mechanism. Caffeine is gonna stimulate, and sildenafil is gonna inhibit this process, and it's gonna make the muscle relaxation, vasodilation. So let's go in here, go to the first nitrates. What the nitrate gonna do is gonna do decrease preload. And preload, there are three kind of the nitrates we're gonna discuss: short acting, intermediate acting, and another one long acting. So it's about the duration. So sodium nitrate, amyl nitrate, sodium nitro prostate, and nitroglycerin, and these are the drugs are for use for the short term. And this is sublingual, it's written over there, you can see here. And the intermediate drugs is simple here, is oral and also in chewable isosorbide dinitrate. So oral and the time duration you can see here, and chewable you can see the duration time. And long acting is over here, isosorbide mononitrate, and it's dinitrate, you can see the difference here. And the time, the half-life, and glycerol trinitrate are the long-acting drug we use to decrease the preload. You have to understand decrease the preload. And beta blockers, there is the most important key points about PMC. Like I said before, PMC exam point of view, atenolol, metapretol, and proparanolol. Okay, the three drugs are most common. You have to understand this. Tol is all the key points for the beta blockers. For the calcium channel blockers, we use for the dihydropyridine drugs, and there are two types. Most common you have to understand: amylopepilin, and nifedipine. These drugs we have to understand for the calcium channel blocker. So now we go here, the simple PDE, phosphodiesterase inhibitors. So what it's gonna do, if it's effect on the brain by caffeine, we can use the caffeine to increase the CMP. And what it's gonna do, it's gonna increase the activity of the brain activation. And we can see here, when we inhibit it, it's gonna be go down with the bronchial smooth muscles. And which drugs we're gonna use here to do it: methyl xanthine derivatives, phenylephrine, theophylline, and theobromine. And there's a key point you can understand, it's called MAT, M-A-T-T, MAT. You can understand this is going to increase the CMP, and it's going to do the bronchodilation. And when it's going to be bronchodilation, and the blood pressure is going to automatically down. And myocardium is going to affect directly is amrenon and milirenon. These are the drugs is going to is the force of cardiac contraction. It's going to affect on it. And what is going to happen on the platelets? There's a one drug you can see, Dreperidimol is going to increase the CMP and gonna do platelet inhibitor. And now we are going to the simplified with every drug, important drug we're going to discuss over here. We see hydrolozine. What is a hydrolozine drug do? It's the artery dilator, and you can see when it's the artery dilator, what is going to happen? Blood pressure is going to go down. So indication, we can see hypertensive, antihypertensive, we can use it. Or eclampsia. What is eclampsia? You can see here, during pregnancy, hypertension use. So this drug, we can use it for the during pregnancy and pre-eclampsia situation. The side effect is simple: flashing, headache, hypotension. If you use it for the high dose and trachydemia, and drug induced SLE. Now we can see here there's another drug over sildenafil, we can use as Viagra. What it's gonna do is inhibit the PDEF on the smooth muscles. What's gonna happen? Effect on the male erectile tissue, pulmonary vasculation, muscle relaxation, erection, pulmonary vasodilation. These are the key points you have to understand. For indication, you can understand here. If you use it for a long time, it's gonna what happen? Erectile dysfunction. And it was also used for female. And how we can use for a female? Not for this purpose. We can use it for primary pulmonary hypertension. So if some doctor recommends to a woman, it doesn't mean it's for the sexual purpose. It's about the primary pulmonary hypertension control. And one of the things you have to say: side effect, flashing, headache, and indication, never ever use it for nitrates. Why? Because nitrates also do low blood pressure. And what is it gonna do? Vasodilation, low blood pressure is gonna happen. So it's not gonna be the good choice if you use it with the nitrates. So we can see here nitrates, one of the most key points here. The nitrates is antianginal drug. Use it for hypertensive crisis, pulmonary edema, and also we can use it for cyanide poisoning. And not all of the nitrates, just particular amyl nitrate, sodium nitrate, use it for it. And the drug of a choice, you can see here, for hypertensive crisis, we can use in nitropyrroside. Okay, for the side effect, headache, flashing, orthostatic hypotension, reflex tachycardia, constipation, metahemoglobinemia. We can understand you here. Okay, if there is a cyanide poisoning, it's gonna affect on here, and we can use it for sodium thiosulfate and thiocyanate, to use it to take out the cyanide from the body. And we can see tachyplexis. What is going to happen? You cannot use it for this drug for 24 hours continuously, and you have to disconnect nitrates for 12 hours, otherwise it's not going to affect after that. And there is some key points here. Contraindication, again, hypertension, never ever use it for sildenafil, Viagra. Never ever use it, because again, it's going to decrease blood pressure. You don't want to make it more complications. So that's it for it. For anti-anginal, I hope you will like this video. Bye.